Hello friends. Today we're going to discuss about cluster B personality disorder as per DSM-5. I'm Dr. Suresh Badadmat, professor of psychiatry working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about cluster B personality disorders. Those are antisocial personality disorder, borderline personality disorder, histrionic personality disorder, narcissistic personality disorder. Their prevalence and management will be discussed in this video. What are cluster B personality disorder? They are a group of personality disorder characterized by dramatic, emotional, or erratic behavior. Unfortunately, the cluster B personality disorders are challenging not only for the family, society, for the clinician and treating team. In this, antisocial personality disorder is the most challenging personality disorder to treat or engage them in therapy. If you look at the cluster A, B, C, today I am discussing about cluster B personality disorder, that is ASPD, histrionic PD, narcissistic PD, and borderline personality disorder. Let's look into the first important antisocial personality disorder. In ASPD, there is a pervasive pattern of disregard for and violation of rights of the other, and they will have at least three symptoms out of the seven. The first one is failure to conform the social norm with respect to lawful behavior as indicated by repeatedly performing the act that leads to arrest of a person. That means they repeatedly break the rules. They are deceitfulness as indicated by repeated lying, use of aliases, conning other people for personal profit or pleasure. Impulsivity or failure to plan ahead is also a part of ASPD. Irritability and aggressiveness is being indicated by repeated physical assault or fights and getting into conflict with law. Recklessness, disregard for safety of self and others. Consistent irresponsibility as indicated by repeated failure to sustain consistent work, behavior, or honor financial obligations. Lack of remorse is a classical symptom of ASPD. They will rationalize their behavior in spite of everyone knows that they are violating somebody else's right. The individuals, usually at least at the age of 18, and the evidence of conduct disorder can be noted at the age of 15. The occurrence of antisocial personality disorder should not be secondary to any mental illness or substance use. Now let's move into the second important category of cluster B is borderline personality disorder. The borderline personality disorder is a pervasive pattern of which is noted as instability of interpersonal relationship, self-image, and affect. There will be marked impulsivity, and these symptoms are present across the context of life. At least five symptoms should be there out of the nine. Let's look into these nine symptoms. First and the foremost, frantic effort to avoid real or imagined abandonment. That means they feel their partner or family members may abandon them. Although there is no evidence for that, but still they believe they will be left alone. They will have a pattern of unstable, intense interpersonal relationship characterized by alternating between extremes of idolization and devaluation. Here, they may enter into stormy relationship, one night stand. These kind of impulsivity is well known. They will also have identity disturbance, that is, markedly and self persistently, they will have unstable self image or sense of self. Impulsivity should be at least in the two areas, such as spending money, sex, substance use, reckless driving, or binge eating. They also have recurrent suicidal behaviors, gestures, threats, and self mutilating behavior. They also report of chronic feeling of emptiness. Invariably, they also have affective instability due to a marked reactivity of mood, that is, intense episodic dysphoria, irritability, anxiety, which usually lasts for few hours, and rarely more than a few days. They also have inappropriate, intense anger or difficult to control their anger. They may also have transient, stress related psychotic symptoms like paranoid ideation or dissociative symptoms can be seen. Moving to the third, histrionic personality disorder. Here in histrionic personality disorder, as the word says, they have a pervasive pattern of excessive emotionality and attention seeking, and they are present in most of the dimensions of the life. That may be it is seen in various contexts. They should have at least five or more symptoms out of the 18, 8 listed under histrionic personality disorder. Let's look into each one of them. They are having uncomfortable in situation in which he or she is not a center of attention. That means if they are not a part of a center of attention, or not, if they are not given importance, they become uncomfortable and they move out of that place. Interaction with others is often characterized by inappropriate sexual seductiveness or provocative behavior. They will have display rapidly shifting and shallow expression of emotions. Consistently, they use physical appearance to draw attention to self. Their style of speech will be excessively impressionistic and lacking in detail. They also show self dramatization, theatrical, exaggerated expression of emotion. They are suggestible and they also consider relationship to be more intimate, but they are not. Let's look into the narcissistic personality disorder. In narcissistic personality disorder, they have a pervasive pattern of grandiosity, need for admiration, lack of empathy, and they are present in various contexts. They need to have at least 5 out of 9 symptoms. Let's look into these symptoms. They have a grandiose sense of self importance. They will exaggerate their achievements, talents, expects to be recognized as a superior without any efforts. They are also preoccupied with the fantasies of unlimited success, power, brilliance, beauty, or ideal love. They believe he or she is special and unique and can only be understood by or should associate with other special or high status people. They require excessive admiration. They have a sense of entitlement, unreasonable expectation of especially favorable treatment or automatic compliance with his or his expectation. They also have interpersonal exploitativeness. That means they take advantage of others for their achievements. They lack empathy. They are unwilling to recognize the identity of the other's feelings, needs of others, sometimes contribution of others. They are often envious of others or believe that they are others are envious of him. They show arrogant, haughty behavior and attitudes. Let's look into the prevalence of these disorders. If you look at the prevalence of antisocial personality disorder, it is 0.2 to 3%. Borderline is up to 1 to 5.9%. Histrionic PD is 1.84 and narcissistic PD is 6.2%. Let's look into the management of cluster B personality disorder. Diagnosis of cluster B personality disorders are striking, and any experienced clinician can diagnose based upon the OPD assessment only. But to completely diagnose, it would be prudent to subject them for various clinical tests, clinical evaluation, detailed evaluation, gathering information from all possible sources, collateral information, observation, and then only make diagnosis. Diagnosis of narcissistic and dystonic PDs are very rare. There are any hardly studies available. Maximum studies are available with regard to borderline personality disorder and antisocial personality disorder. Let's look into the diagnosis of cluster B personality disorder. As I mentioned, there should be a detailed clinical evaluation, clinical interview, observation, and gathering collateral information. Sometime you can use projective tests also. The general personality assessment tests, such as personality assessment inventory, that is SPI, SKID, that is structured clinical interview for DSM-5, Minnesota multiphasic personality inventory 2, Millen clinical multi-axial inventory 3, personality diagnostic questionnaire 4. With regard to specific screening scale and also diagnostic scale, For ASPD, you can use psychopathy checklist revised, that is PCLR, antisocial processing screening devices, that is ASPD. With regard to borderline personality disorder, you can choose McLean screening instrument for borderline personality disorder, or else borderline personality disorder severity index. And finally, for NPD, that is narcissistic personality inventory can be chosen. Let's look into the cluster B, personality disorders treatment. Let's look into the ASPD. There was a Cochrane review done in 2020 by Khalifa and his colleagues. And in this Cochrane review, they reported there is not enough of evidence to determine whether or not medication is helpful for treatment of personality disorder, especially ASPD. That means Cochrane clearly said that in 2020, pharmacological indication is nil. Similarly, what about psychological intervention? Again, this study was done by Cochrane Group, that is Gibson and his colleagues in 2020. With regard to psychotherapy, this report clearly said that the review shows that there is not enough of good or quality evidence to recommend or reject any psychological treatment. With regard to diagnosis of antisocial personality disorder, that means either pharmacological treatment or psychological treatment cannot be recommended with regard to antisocial personality disorder. Let's move into borderline personality disorder. Again, there was a Cochrane review done by Storb and his colleagues in 2020. They looked into psychological therapies for people with borderline personality disorder. In this review, they included 75 RCTs involving 4,507 participants, and psychological therapies which were considered in this review were 16 different therapies. And if you look at the outcome, the beneficial effects on all primary outcomes was in favor of psychotherapy compared to treatment as usual. The pooled analysis of psychotherapy versus waiting list or no treatment found significant improvement on borderline personality severity, psychosocial functioning, and depression at the end of treatment. But these findings were based on low quality evidence. However, dialectical behavioral therapy for BPD showed improvement in severity of symptoms, self harm, and psychosocial functioning. Similarly, there was one more study done by Winterling and his colleagues, and it was published in British Journal of Psychiatry in 2022. The title of the study was Psychotherapy for Borderline Personality Disorder, a focused systematic review and meta analysis. In this study, they undertook 31 RCT were included in this study, which were totaled about 1,870 participants coming to picture. Among the standalone treatment, statistically significant effects were observed with regard to dialectical behavioral therapy, and they found improvement in severity of borderline personality disorder, self harm, and psychosocial functioning. And they reported there is a reasonable evidence to indicate that borderline personality disorder can be treated with psychotherapy and specifically dialectical behavioral therapy. What about medications in borderline personality disorder? There was one more important study done by Gerald and his colleagues in 2021, and this was published in CNS Drug. The title of the study was Pharmacological Treatment for Borderline Personality Disorder, a Systematic Review and Meta Analysis. In this study, they included 21 RCTs, including 1,768 participants. 19 RCTs compared pharmacotherapies with placebo. 2 RCTs assessed active treatment head to head. The evidence indicated that efficacy of pharmacotherapy for the treatment of borderline personality disorder is limited. There is a low evidence indicates that anticonvulsant and antidepressants can improve specific symptoms associated with BPD, such as anger, aggression, and affective liability. But the evidence is mostly limited to few studies. Second generation antipsychotics has a little effect on the severity of borderline personality disorder, but they improved general psychiatric symptoms in patients with borderline personality disorder. There was one more Cochrane review done by 2022 by Stoffer and Wirling with regard to pharmacological intervention for people with borderline personality disorder. In this Cochrane review, 46 studies were included, which had 2,769 people with borderline personality disorder, and 27 different medications were reviewed. They were categorized into three important components: antipsychotics, antidepressant, and mood stabilizers. The results of the study were stunning. Compared with placebo, medication seems to have little effect or no difference for borderline personality disorder with regard to severity, self-harm, suicide-related outcome, and psychosocial functioning. However, they indicated if there are comorbidities such as depression, social phobia, anxiety disorder, to treat those comorbidity, these medications may be useful. There was a JAMA review in 2023 by Falk and his colleagues. Here, they looked into the borderline personality disorder with regard to prevalence, treatment, and recommendation. In this JAMA review, they said that psychotherapy with dialectical behavioral therapy and psychodynamic therapy are the first line of treatment in borderline personality disorder. Psychoactive medications do not improve the primary symptoms of borderline personality disorder, but they may have a role in comorbidities such as depression, anxiety disorders. Further, there is no evidence with regard to histrionic personality disorder and narcissistic personality disorder. Since there is no evidence, it is very difficult to give strong recommendation with regard to treatment. However, psychotherapy can be advised in histrionic and narcissistic PD. Management of comorbidities are very essential, and medication can be used both in histrionic and narcissistic PD. To summarize, my dear friends, ASPD, there is no treatment available at this point of time. With regard to evidence, both medication and psychotherapy are not useful at all. With regard to borderline personality disorder, dialectical behavioral therapy and psychodynamic therapy have been found to be very useful on various studies. With regard to histrionic personality disorder and narcissistic personality disorder, there are hardly any studies. Hence, we are unable to give any kind of evidence-based recommendation with regard to treatment. Thank you very much for giving your valuable time